Hello, I'm Dr. John Westfall, the Chief of Anesthesia here at Hill Country Memorial.
And I am Marilyn Berry, the Restore Program Coordinator. On behalf of the hospital and the entire Restore team, we'd like to thank you for choosing us for your joint replacement.
At Hill Country Memorial, our vision is empower others, create healthy, and this is the aim of our Restore program. Our program's goal is to empower you by getting you back to your healthy lifestyle as quickly as possible. Today, we are going to talk to you about your anesthesia care plan for your upcoming surgery, and further share what makes Hill Country Memorial the right place for you to have your surgery.
Simply stated, we're dedicated to providing our patients with remarkable care. Under the leadership of our outstanding orthopedic surgeons and with our 5-star patient-rated experience, we're now #1 in Texas and in the top 5% in the nation for excellence in major orthopedic surgery.
We've standardized our approach at every step in your surgical process from beginning to end, and we feel confident you and your family will find that Restore provides you with a unique experience, state-of-the-art care with a personal touch.
Early mobility is critical to your successful recovery. Our anesthesia practices get you back on your feet faster so that you can participate more fully in your physical therapy. While we can't take away all your pain, the Restore team is committed to working with you every step of the way so that you can achieve results quickly and safely. Now, let's talk about your care plan and how we stop pain and inflammation before they start. Once you complete registration, you'll be brought to the preoperative holding area where our nurses will verify your information for safety purposes. In fact, you may get tired of providing your personal information, but keep in mind, it's all for your safety. Once we reviewed your list of allergies, you'll receive your Restore Pain Control Protocol that includes state-of-the-art, long-acting pain medicine, as well as anti-nausea medications. By giving you these medicines early, we're blocking pain and nausea signals before they start. This proactive approach is called preemptive analgesia, and we'll continue using it day and night during your recovery to stay ahead of your pain.
Next, you'll meet your anesthesia provider who is trained in the art of joint replacement anesthesia. Your anesthesia provider will review your personal information and will tailor your anesthesia to meet your needs. Your anesthesia provider will walk you through the steps in your surgery and your road to recovery. Typically, these steps begin with at least 1 numbing injection, possibly 2, along with an IV anesthetic. If you're having total knee replacement surgery, then your first injection will be a nerve block that will serve as the centerpiece for your pain control after your surgery. With the use of an ultrasound machine, your anesthesia provider will pinpoint the nerve that provides the majority of sensation to your knee joint, and blocking it will provide pain relief until your Restore Pain Control Protocol has reached its peak effect. Spinal anesthesia, also called a saddle block, is the second numbing injection that we often use for both knee and hip replacement surgery. This is an injection of local anesthetic in the small of your back that numbs everything below your belly button. Spinal anesthesia provides several major safety benefits. These benefits include less blood loss, which decreases the risk of blood transfusion, a lower risk of blood clots, and best of all, better pain control. All together, these benefits mean less stress on your body with a safer and quicker recovery. You're probably wondering if you'll be awake during surgery. Typically, the best approach is for the patient to be asleep. If a spinal anesthetic is not an option for you due to your allergies or other underlying health issues, then we'll give you a general endotracheal anesthetic. This means that you will drift off to sleep with a breathing tube. Either way, we will care for you like we would our own family.
Once your anesthesia provider completes your assessment, your surgeon and nurse will greet you before you head to the operating room for surgery. Your nurse will verify your personal information again, while your surgeon will mark your surgical site with a pen and answer any last-minute questions that you have. After one last safety check, we'll take you to the operating room and begin positioning you for surgery. At this point, your anesthesia provider will start your IV anesthesia, allowing you to sleep during your surgery. While you are asleep, your surgeon will replace your joint and your medical team will monitor you throughout your surgery. We'll also keep your family in the loop during your surgery. We'll assign you a number that your family members can use to keep track of where you are in the process, from pre-op to recovery. Nurses will also call them during your surgery to let them know how you're doing.
Once your surgery is complete, you'll be brought to the recovery room. Here, you'll have a nurse caring for you as you wake up, and within a short time, you should be able to have something to drink. Before you head to your private room, your recovery nurse may give you a pain medication as part of your pain control protocol. It's important to stay ahead of your pain, so every 4 hours you'll be offered a short-acting pain medicine. It's a good idea to take this medicine even if you're not having much pain so that you can prevent any pain impulses that might arise over time. At times, your pain level may rise unexpectedly, and we'll give you stronger medicine intravenously. IV pain medicine will be given as needed for moderate to severe pain. But again, we encourage you to take the oral medicines as your first line of defense against pain. We do realize that some of our patients may have intolerances or allergies to some pain medications, and we will adjust your pain protocol accordingly.
We hope we've answered your questions about your anesthesia care plan and post-operative pain control. On the day of your surgery, you'll have a chance to review this information again with your anesthesia provider. Our award-winning Restore team is looking forward to giving you remarkable care and helping you get back to your normal activities as quickly as possible.
We thank you for choosing Restore at Hill Country Memorial.
And we look forward to caring for you.